This presentation is going to cover the headache codes, and a lot of people will see this code crosswalk G44.1, and it's listed as a vascular headache. Now, I looked this code up, and it turns out that it's an outdated term. It is no longer a recognized term and not mentioned in the headache classification of the International Headache Society, or IHS. However, the term is in the ICD-10. There's another code, R51, and this is a very generic headache code. So more specifically, we would really want to code tension headaches, which actually are about 70% of all headaches, and they're not that difficult to diagnose, and there is additional training you can get on headaches. And I tell all my clinics that you could become the headache czar of your city. A lot of primary care doctors and even neurologists will want to send their headache patients to an eye care professional to determine if their refractive problem, if they have a problem with their eyes, and that's the cause of their headaches. So you want to rule out other ailments. Also, people that have visual auras are something that they'll come to you and try to see if they have an eye problem or some other type of issue. So we mentioned earlier, again, the word intractable is synonymous with what we call pharmacoresistant or treatment-resistant. And then the status migrainosus is any migraine that persists longer than 72 hours. The main code here is G43, and note we have a migraine without aura, and then you need to simply fill in the flags of whether it's intractable or with status migrainosus. And then you have the migraine with aura, and again, intractable or not. So there are a total of 8 codes for that. Now, concerning the ocular migraine, in ICD-9, we have 346.20. In ICD-10, it becomes G43.B, and note that there is a B in the middle of the code, 0. And here in ICD-9, we have 4 different code for migraine. Again, the issue of intractable and status migrainosus already exists in ICD-9. It's nothing new. So this has been around for 10 or 15 years already in ICD-9. Now, when you do the crosswalk of the ocular migraine, it will crosswalk to more than one ICD-10 code. It's going to crosswalk to G43.809, which is other migraine. It will actually crosswalk to a cyclical vomiting, not intractable. It will also crosswalk to the ophthalmoplegic migraine, which is the G43.B0. Also, we have these other migraines, periodic headache syndrome, and then abdominal migraine. Now, our main concern is this code, G43.B0. Now, the term ocular migraine can be confusing, as some use the term also to refer to a retinal migraine. In some cases, ocular migraine describes a migraine aura that involves vision. Migraine auras include a variety of sensations that are often visual, but which may also include other sensations such as numbness that precede or accompany a migraine. Sometimes you can get an aura that occurs without an associated headache. So these are often called migraine auras without headaches. Now, the visual symptoms are short-lasting, and a migraine aura involving your vision will affect both eyes, and the patient will sometimes see flashes of light, zigzagging patterns, blind spots or shimmering spots or stars. So these are the aura symptoms for an ocular migraine. Now, a lot of people use this term, migraine aura without headache. Now, when you research this, you'll find that a lot of people have a lot of names associated with this. They'll call it an optical migraine. They'll call it an ocular migraine. They'll call it a cephalgic migraine. encephalgic migraine, migraine or without headache, and migrainosus migraine. So there's like 7 or 8 different names for this one condition. They're not all the same. Now, the patient may experience visual blurs, nausea, photophobia, hemiparesis, paresis on one side, and other migraine symptoms, but they do not experience a headache. Now, it is sometimes distinguished from a visual-only migraine or without headache, also called an ocular migraine. However, it is the same ICD-10 code as an ocular migraine. You got B43.B0, ophthalmoplegic without refractory migraine. That's the not intractable. In the ICD-10 manual, there's an include statement that will say an ophthalmoplegic migraine, G43.B0, and also a migraine, well, it says here, it's without refractory migraine, G43.B0. So these are codes, these are included under that one code. Now, the retinal migraine, which is G43.81, this is a different ICD-10 code. And this usually involves repeated bouts of short-lasting, diminished vision or blindness. These bouts may precede or accompany a headache. Now, my understanding is that retinal migraines are very rare. They're just not that common. A migraine headache, unlike a migraine or affecting vision, will only affect one eye, not both. However, most often, loss of vision in one eye isn't related to the migraine. It's generally caused by some other more serious condition. Now, the migraine term is often misused to mean any migraines that involves any visual symptoms or a migraine with visual symptoms, but without the headache phase of the attack. That describes an ocular migraine and the other code, G43.B0. So here is the ICD-2 listing for a retinal migraine. And again, it's very detailed here, but anybody can look this up. And again, my point here is that when you talk to the doctors, a lot of them will use these codes interchangeably. And if you look up on the internet, you also will see numerous definitions, including our friend's Wikipedia, where they are listed as being synonymous, and they're simply not. The retinal migraine is repeated attacks of a monocular visual disturbance, including scintillation, scotoma, or blindness associated with migraine headaches. And then we have our criteria here, B and C, to attacks. And then you have a headache criteria. And note that appropriate investigations exclude other causes of transient monocular blindness, such as amaurosis fugax, which we mentioned earlier, optic neuropathy, or carotid dissection. So the point here is that this very short presentation is just to show you that it took quite a bit of research, and it was interesting discussions with doctors. If you have any questions, you can reach me at jeff@eyecodingforum.com.